Today I'm pleased to announce that we still only have 4 patients that have been confirmed to have the novel coronavirus infection in New South Wales. So there's been no new patients have been confirmed. I note that the total across Australia is 12 confirmed patients. We currently have 24 suspected patients that are under investigation, and pleasingly we've cleared 134 people have tested negative for the infection. As I've indicated, the fact that we're seeing more cases under investigation indicates that people are coming forward for testing. It also reflects that our case definition has broadened to anyone who has returned back from mainland China and who has developed respiratory symptoms, even those that are in the milder spectrum. Within 14 days of their return, we're asking to come forward for testing. We've also been deploying teams at the airport, and I'm pleased to announce that on Sunday, the 2nd of February, we met 1,680 people were screened by the New South Wales Health Team, and 9 were referred for testing, and all of those tests came back negative. On Monday, today, as at 2 p.m, we screened another 1,500 people returning from China. 6 were referred to testing, and we're expecting that there'll be around another 400 people for screening this afternoon, because we'll be on duty till the last planes arrive. Happy to take questions.
The people that do have the virus, are they still in the same state, or are they showing signs of recovering?
So 3 of the patients were discharged and are doing well, and 1 patient remains hospitalised but in a stable condition.
And is that a person, are those people who have been discharged confirmed to have the coronavirus?
Those were the 4, so my comments relate to the 4 people confirmed with coronavirus infection. 3 of those have been discharged and are doing well in the community, and the other patient is still an inpatient and their condition is stable.
Given that these people are being able to recover in hospital, does it show how Australia is on top of it and managing the virus?
What we are observing is a spectrum, and we're understanding that the novel coronavirus infection is causing quite milder disease as well as the more severe disease. We currently only have a small range of patients, and I'm not here to comment on the clinical details for all of those cases. But I think what we're seeing is a spectrum, but it's been pleasing to see that we haven't, to my knowledge, had people that have required intensive care or more of the very severe end of the spectrum of the disease, which has been reported in some countries, and clearly some deaths.
Everybody went back to school last week. Are you fairly happy with how that went in terms of coronavirus spread?
We liaise closely with our colleagues in the Department of Education, and I want to acknowledge the good work that the Department of Education, their teachers and principals have undertaken. So I haven't heard any issues that have been raised with me, but really the Department of Education would have a much more hands-on feedback. But I'm pleased that the community responded to the messages around not returning to school if you'd come from China as an additional precaution, and also the message around if you'd come back from the Hubei province to particularly stay away and self-isolate.
Have there been any issues in terms of resistance to some people coming back from China who may not want to self-isolate?
We have had intensive engagement with our contacts of cases, and I would say that in my interactions with a number of representatives from the Chinese community, there's been a strong level of awareness. It's been certainly circulating widely on a number of community information platforms, and nothing's been brought to my attention about concerns about people not taking and heeding the advice. And I suppose the corollary of that is we continue to get calls from people that are going to either ring their GPs, going to EDs, or ringing the Health Direct number. And the fact that we are testing patients, people coming forward, gives me a degree of confidence that we are doing our best to detect any cases in the community, so we can ensure that there's even more stronger isolation and quarantining of the contacts of any confirmed cases.
And do you expect those self-isolation advice, do you expect that to remain in place for the rest of February?
The Australian Health Protection Principal Committee is continuing to meet daily. I was late for this teleconference because we were just concluding a meeting. And it's very important that we monitor the evolving situation. And I think what we've learnt from previous infectious disease outbreaks is we need to continually be prepared to adjust our response. So at the moment, the objectives of our response are clearly containment, and all the actions we've put in place are aimed at containing the virus's spread in the New South Wales community and the Australian community globally. We need to learn more about how severe the virus is, how easily it's spread, its transmissibility in mild disease. All of these factors will be critical to our understanding about whether containment in the long term remains an objective. So the message is we are looking daily at the new information that's arising, and we will modify our advice depending on the results of that intelligence from across the world and particular analyses we're undertaking in Australia as part of that work that we're doing with the Commonwealth and other states and territories.
Of those 3 that were discharged, is there any ongoing monitoring to check if the virus returns, or are they still being medicated?
So the patients were screened for virus detection. They were also, for the utmost of precaution, asked to self-isolate for 7 days after discharge, and there will be repeat testing. And there was also culturing of the virus tests. So a comprehensive plan was put in place, and the public can be confident that they pose no risk.
Is it the advice of the Australian Health Protection Principal Committee to stop foreign nationals coming into Australia this Saturday?
So the Australian Health Protection Principal Committee advised a range of border measures, and those comments haven't got them printed out before me, but the statement issued by AHPCC reflects the decision of that group. But border measures are ultimately a matter for the Commonwealth. As you're aware, those Commonwealth actions have been put in place, and our role has been to deploy health teams to the airport to assess returning travellers who may have transited China or come directly from China on flights, ensure that we screen, assess them and test them. And we're taking a very precautionary approach to screening people with even very, very mild symptoms. As we have learned, increasingly this disease can have very mild presentation, and so to not miss any cases at all, we're taking this very precautionary approach.
We've seen online a lot of people asking what self-isolation is. When you're asking people to self-isolate, what do you want them to do?
We just want to take self-isolation. We've got actually quite detailed information, and that's translated on our website. I think it should be loaded. But clearly people can walk outside. People can walk in the street, wearing a mask, walking in the street, as long as they're not in direct contact. So we want to make sure that we're also managing the well-being and the mental health of patients in self-isolation. And we've given the instructions in that sheet that protect public safety, but ensure that there isn't a risk to the community from the activities that people can do whilst in self-isolation.
There was some modelling that came out today on the ABC that said 3 million cases could appear in the next 3 months in hospitals. Is this a concern for you guys?
The Australian healthcare system is a robust one, and we've been tested at various times in my professional career. We've been tested with the 2009 H1N1, known as swine flu pandemic. We've also had experience with SARS and MERS. So in New South Wales, we have a very networked system, and a lot of the work that we've done over many years has really given us a resilience in the face of emerging threats. So we have a lot of planning in place should we need to surge any health assets. We have great intensive care unit capabilities. We have plans. We have plans for vaccine rollout. So all of the preparation work will stand us in good stead should that arise. But at the moment, I can't stress enough, we are currently, our actions to date are really trying to detect cases and contain spread.
Last week there were some developments with Australian scientists managing to recreate the virus. So we've got some testers of it. I'm just wondering if, like, down the line or soon, there might be a way for us to properly test for the virus in people rather than just looking for symptoms.
So we actually do have a test for the virus. So it's a PCR-based test, and our laboratories from the beginning were able to test. Obviously, they needed to, because they didn't have actually any virus, they were having to do it from the genetic material. But as we've had cases, our labs have worked really collaboratively to make sure that we've got what's called control specimens, and so that our tests are valid. So we now have great confidence in our tests. And what we're now doing is scaling up those tests. So we've moved from one laboratory in New South Wales to be able to undertake the test to 2 laboratories. Those laboratories can increase the frequency of the tests, like do a couple of runs a day, so we're more rapidly getting those tests. And then we can expand that to other laboratories as we need to. And clearly, as we, in a technical sense, streamline the tests and use more like kit-based test, it can mean that the size of this number of samples that can be tested on every run can actually be increased markedly. And so initially we were constrained by having about 50 samples on the run, but we hope progressively that will be able to be increased as we routinise it, bring it into our the way we do routine testing for respiratory viruses.
And overall, would you say the situation with coronavirus in New South Wales is fairly contained at the moment?
I'm pleased that we have seen increasing rates of testing, and I suppose in the next little bit we're planning for actually trying to get more people tested, because we want to really test and make sure that we're not missing anyone with the disease. And so the fact that we haven't had any more confirmed cases gives me some reassurance, and the fact that we're testing lots of people, I would anticipate and will be messaging around testing more to really give us that assurance. And we'll also be using some of our other surveillance systems to really check that we're not missing anything in terms of transmission. But at the current time, there is no evidence of transmission outside acquisition, either through contact to a case, confirmed case from China, or a contact of a contact with confirmed disease that may have acquired outside China, or the travel, coming back from, most of our cases have travelled to Wuhan directly. And
yeah, also when you say you want to look at testing more people, are you saying extending the test beyond airport arrivals?
So we are testing the community, and we're asking people to self-present with symptoms. As throughout the outbreak, we initially focused on the Wuhan, city of Wuhan. Then as we got evidence that it had spread, there was community transmission more in the Hubei province of Wuhan is a major city. We've then spread our net to capture those people who have spent time in Hubei province. And now our case definition is anyone who's travelled to mainland China. So progressively, we expect that we'll capture more people coming forward that fit into that category. I'd like to also say that as I've said, 134 people have tested negative, and most of those have different viruses like respiratory syncytial virus, flu, rhinoviruses. So in all likelihood, people that are coming forward will have an alternate diagnosis, but it gives us reassurance that we have, we're not missing cases. And at this moment, we're trying to not miss cases. And that's why I can sort of give you that reassurance that we don't have any evidence at the current time that there is any community transmission outside those direct links that I just discussed.
So do you still want people to come forward if they haven't been in contact with people from Wuhan or China? Or?
No, at this stage, the risk group is really understanding the risk associated with broader travel to China. So clearly, we want anyone who's come from the Wuhan city, Hubei province, and now we're saying the China mainland to come forward if you have respiratory symptoms with or without fever and get testing. So this will take a little bit of a transition, but we're raising lab capacity and we're working with our partners in the laboratories that can take the specimens safely in the private laboratory sector to really increase access to testing. And we'll work with our colleagues in general practice to make sure that general practice is well positioned to safely manage these patients and increase access to diagnostic testing.
Are you able to give us any sort of indication of symptoms as to why the male is still in hospital in comparison to the other three? Was there a chronic illness that he had historically, something like this that's made his symptoms worse?
Look, not that I'm aware of, and I've got to say we get given information which is relevant to our understanding, and we do protect patient, privacy. We are obviously interested in knowing if people have got significant, and we know from the overseas information that people had a worse course if they actually had significant underlying comorbidities. This gentleman still isn't in the most severe of severe areas, so he's been stable and had some ups and downs. But he still hasn't been in that area that requiring intensive care unit admission and that more severe end. We, I suppose, know, as I said, that patients with underlying comorbidities, respiratory, heart disease, diabetes, are generally more at risk of having adverse outcomes, and age, and that's borne out by some of the data that's coming out internationally. I haven't actually got a patient update today, but I will follow that up, and we will obviously announce that in due course. But obviously we're taking a very precautionary approach, and we also know that for some people they can have a course which is improvement, a bit of a decline, and improvement. And I think we're all taking a very watchful approach. Thanks, everyone.